Hey everybody, it's Eric here. I'm in my backyard in self-isolation, day number 9. I landed in on Sunday last week and was ordered by the CDC to self-isolate for the next 14 days. And so I've been in my basement or out in the backyard. My wife is out here too, but she's about 30 feet away. And we haven't even been able to give each other a hug since I got back. So looking forward to day 14 being behind me. Wanted to talk about a couple of things and thought it'd be kind of useful for me to deal with some of my anxiety and just distraction and whatnot, to do a video every day about something different, something that concerns me or that I'm thinking about as we're dealing with this time of crisis where we're all being asked to stay home. And the thing that's today, the subject of today is volunteerism. Here we go. So volunteerism is a pretty cool thing, and it's something that we've had around for a while. Definitely something where people have asked to step up and, donate time to their community and whatnot. So it's nothing new, really, but what's happened now with the strain that's going to be put on our healthcare system is that they're reaching out to a bunch of people who have already retired that are healthcare workers. Anybody who can fill a role in the healthcare community, they're having move into that role. If they're a nurse and they're in a different department and they can be moved in to deal with COVID patients, they're being trained how to work in ICU. If they're med students and they're just about to graduate, as in the case of New York and I think also California, but definitely New York, if they're supposed to graduate this summer, they're letting them graduate now, as long as they're going to be willing to be an intern and work in an ER. And put themselves on the front line. They're graduating med students early now, just so that they can deal with it. And it got me thinking, I'm not a med student. I didn't go to school for anything. In fact, I'm disabled. Like, what can I do? It's like that whole little drummer boy story. What can I do that I can help in this situation? And it dawned on me that what I can do is help the local community, help the local city government with communication. So if they're interested in helping put messages together for residents who aren't sure what's going on in these really uncertain and dynamic times, that I can help do that. I can help do videos to reach out to the community and say, hey, this is what's going on and here are the resources, and if you need something, here's where to call, and here's how you go about taking care of whatever your needs are. We're all going to go through trying times with this, but it dawned on me, that's my skill set, but there's probably anybody watching this video who's got something that they are good at. There's something that you have a skill at, well, now's the time to make that available to others. It's a great time to volunteer. So this video is about volunteerism. People who have the skill set that's needed immediately in the hospitals, they're being asked to volunteer. I'm certain that tons of drivers are going to be needed because everybody's going to be asked to stay home. Food's going to need to be delivered. There's going to have to be protocol with that. Obviously, if you're worried about work, pretty much every grocery store or just distribution type business is hiring right now. It's hazardous going to work in that environment. I don't understand if you don't want to go to work, but there are a number of ways that we can all pitch in and help get through this. And it's one thing to ask healthcare professionals to volunteer, but I think we can all do that. My background is in communications and in journalism. And so I've reached out to the local government here, and hopefully they take my offer. But each of us can do something. We all have a skill that we're good at. There's in the UK, they actually brought up 400,000. They wanted 250,000 volunteers to sign up in a 48-hour period, and in 24 hours they had 425,000 volunteers. These are people who are going to be calling to check up on elderly people who are shut in. There are a lot of needs besides just somebody working in the ER or the doctor that knows how to put an intubator in. There are a lot of other needs that are going to come around here, and like I said, things are going to get a lot worse before they get better. So if there's anything that you think you can do to help, now's the time. I know what I've offered to do, and if I'm not taken up on that, I'll find somebody else to help. But now's the time. We're sitting around in the house. It's a great way to avoid the anxiety that comes with uncertainty. We don't know what's coming. It's clear we don't know what's coming. So anyway, I just thought I'd reach out and say, you know what? You don't have to be just a victim in this situation. You don't have to sit idle and be passive. You can actually take an active role in this crisis that's unfolding right in front of us. And that is by identifying something that you can do and reaching out to either a local hospital, seeing if they need volunteers. That's the first place to start. Local food banks are probably going to need volunteers. Anything that is essential to existing and living and getting by. Checking up on seniors that might have, there might be a need for that. I don't know. I'm just throwing out some ideas. I know what I've offered to do. I know what I'm capable of doing. So I don't see myself driving a whole lot. I have a spinal injury, so I see myself more doing the communications kind of consulting sort of thing, maybe helping put some videos together. So anyway, I just wanted to throw that out there. I'm as worried as you guys all are about this, but we don't have to be passive. We don't have to sit by and watch this happen to us. This is stoicism in action. You know, there are things that are beyond our control. This virus is beyond our control. But how we react to it, that is within our control. Marcus Aurelius would know how to react in a situation like this. So keep your head down and focus on the important things at hand. All right. Love you all. Take care.